This is the Emerging Trends Symposium on Acute and Chronic Liver Failure. So patients with chronic liver disease have very rapid decompensation, and this rapid decompensation can be related to many events. And this rapid decompensation, which relates to liver failure as well as extra failure of other organs, we call that acute and chronic liver failure. The reason we put this together is most of all for people to be aware of this condition, that it occurs, and try and stimulate some discussion and research on finding better ways to diagnose and treat this condition. So I think people recognize that they're seeing a lot of patients like this and they're finding difficulty in treating them. And we recognize this as a huge clinical problem, and so it's really important for a lot of people to know more about this, but even more important is to study this more and come up with solutions.
The major takeaway, I think, was what some of the new modalities that are being used to treat it. Granulocyte colony stimulating factor was brought up today. That's very interesting to see where that's going to go. And then the importance of how to assess our patients for infection and prevention of them going into fulminant hepatic failure.
First thing, this is the inflammation that is one major cause of acute and chronic liver diseases. That was one point which I thought was very interesting. And the second was this growth factors that we can use in certain patients. Those were the two messages.
We're seeing more and more of this entity, and I think it's not well defined. In fact, there's multiple definitions of this syndrome. So we are all faced with treating these people, and with the more and more cirrhotics being around, so to speak, we're certainly seeing more of it.
Infections with Clostridium difficile have been a significant factor, and that was no surprise, but that fecal transplant, which is the new emerging therapy for Clostridium difficile, seems to be well tolerated in patients across the country, per Dr. Bajaj. The other was this thought about GM-CSF, which I had not had any exposure to, and I'm very excited to hear that there's more promising outcomes now for the patients with acute on chronic liver failure with this new emerging bone marrow-based therapy.
We're hoping most of all that there are 3 large consortia worldwide that we'll all work together with the same purpose to try and find solutions to this, come up with better diagnosis and better treatments.